joining to discuss this further is Dr. Brian Conway, infectious diseases specialist. Doctor, tell us more about this type of strep. How is it different from other strains?
Well, first, our condolences to the 4 families affected here in British Columbia. This is more than any human heart should be asked to bear. But as you pointed out, the Group A strep infection occurred after a viral respiratory infection, influenza in 2 cases, metapneumovirus in the other 2 cases. And Group A strep came as a secondary infection where there was already an illness occurring and immunosuppression, weakened immune system from that illness. And it's in those settings often that Group A strep will cause more serious infections, spread to the bloodstream, and lead to very serious outcomes.
So what kind of symptoms should parents be watching for? And also, can it be confused with, say, the kind of sore throat you'd get from a common cold?
Well, a common cold's a different virus that causes a sore throat, but doesn't really make you sick. I think that if you get sick very quickly, this illness, invasive Group A strep, spreads very quickly. It makes you sick quickly. So if that happens, I would be concerned. A high fever doesn't respond to acetaminophen or other interventions. Progressive shortness of breath. A child in particular who gets lethargic, isn't responding, isn't eating well. Those are causes for concern and should lead to a consultation with a healthcare provider, if not a visit to the emergency room.
Now, these 4 deaths in BC, obviously so tragic. Does it concern you that this might not be the end?
Well, I think we're in respiratory illness season. So as long as we stay in winter, we'll have viruses spread, COVID, influenza, RSV, metapneumovirus, and Group A strep can come as it has happened in those 4 cases on top of that and cause serious consequences. So I think we just need to be vigilant. Get your shots, stay home if you're sick, consult if you need to. Don't be afraid to go to the emergency room if your child is sick. The system is overloaded, but if your child is sick and needs attention, please seek that attention because strep can be treated with antibiotics. And the quicker the antibiotics are administered, the less likely it is to have serious consequences from this infection.
So when is it time to go to the emergency room or go to the doctor?
Well, the illness progresses very quickly in some cases, and that's different from many other infections, and that should be a concern. A fever that's very high, an individual's getting more short of breath, and especially in children, they're getting more lethargic, everything hurts, their general condition is deteriorating. At least call the helpline that is available to you. And again, I think the healthcare system needs to potentially stop saying that please don't come to the emergency room. I think these are mixed messages. In the current context, going to the emergency room is really indicated if any of these things are happening.
What's the best way to protect ourselves? Do we go back to masking?
We go back to getting our vaccines. We're really under-vaccinating for COVID and influenza. These can be the primary infections onto which the Group A strep can superimpose itself and cause serious damage. Stay home if you're sick. Wash your hands and wear masks in indoor spaces where it's crowded. I think this is mask etiquette. We're not looking at mask mandates, but let's always think of wearing a mask. If you go to the emergency room, they'll give you a mask to put on while you're waiting to see healthcare providers. And I think this should be a good guideline for us all in similar situations.
All right, Dr. Brian Conway, infectious diseases specialist, thanks for joining us today on this important topic.
Thanks, Renee.